Hi, I'm Dr. Tom Klein. I'm here to answer some questions that have been submitted to us. So let me read these questions and I'll tell you the answers. I'm an avid golfer and it seems to be suffering from tennis elbow. Even though I don't play tennis, what do you recommend to not only alleviate the pain, but to make it better in the future? This is a difficult one. When you're talking about tennis elbow, what you're talking about is damage to a tendon and a ligament that's attached to the elbow. That means that there's been repeated tears in the elbow. Those repeated tears can heal quickly if you do nothing and if it's allowed to heal early in the process. But if it's delayed or if the damage has been significant enough, then the scarring will cause slow improvement and many times even up to a full year to improve. For most people, it means removing them from the things that they're doing that are causing it. It also means that they should probably do stretching of the elbow. And that's a difficult one. To stretch tennis elbow, you have to use your fist, make a tight fist, and bend it down as far as you can with your arm as straight as possible, and then you rotate it. And you do that over a period of a number of weeks, and sometimes that's very successful. It'll stretch out the scar tissue, but for other times, even that's not successful. In those people, you have to have shots, or sometimes even see an orthopedist. If you do absolutely nothing, many people will get slowly, progressively better without any effort whatsoever, as long as they don't continue to do the things that cause injury to the tennis elbow. What are the symptoms of Lyme disease? Lyme disease is a scary one. It's difficult. And for this one, it would be an hour-long discussion that you don't want me to go through, so I'll simplify it. Lyme disease was not known until Lyme, Connecticut, and that's been within the last few decades. A couple parents brought their children in because they didn't believe that they had juvenile rheumatoid arthritis. These mothers in the same neighborhood brought a group of kids to the hospital and said, "We want to know what's wrong with our kids." And they were diagnosed incorrectly. When they brought them to the hospital for the first time ever, they found an infection called borreliosis, or Borrelia. Borrelia is the organism that causes Lyme disease. It's of a difficult type of infection called a spirochete. Spirochetes are hard to kill. They can smolder, they can linger, they can come back. And so there's been these debates, and I won't go into them at length, talking about whether or not one should kill, and it's killable within weeks and months, or whether it's killable in months and years. And there are doctors on both sides that feel very strongly that it should be treated for an extended period of time, and others that believe it can be treated in only a short period of time. In either case, what I can tell you is that Lyme disease causes neurologic symptoms like its cousin, syphilis. If you had studies of syphilis, and if you were around during the time when syphilis was being discussed long ago, when there was a pianist by the name of, forgive me, I even forget his name. But there have been a number of different types of infections that slowly, progressively destroyed the brain, caused dementia and ultimate death. Well, so too Lyme disease damages the neurologic system within the body, and if untreated, is potentially lethal. So it's transmitted by ticks that were originally found on the East Coast, and now has been found spread across the northern tier of the country into Minnesota and down the southern tier of the country along the coasts into Florida, and now even along Texas and Oklahoma and into California. So Lyme disease has gone from being relatively confined in the East Coast to spread mostly across the United States. In the state of Kansas, it was thought that we had no Lyme disease at all. And so if you became ill in Kansas, it couldn't be Lyme because it wasn't here. Well, unfortunately, that is no longer true. Within the last year, there have been confirmed reports of Lyme in people who got it no place other than in Kansas. Lyme disease requires that you go see your doctor. It often starts out after a tick bite within about a week to 2 weeks with what we call a bullet lesion. It looks like a target around the area of the bite, a redness with darker red areas and lighter normal areas, and then it can slowly progressively grow and then will disappear. But flu symptoms, body aches and pains, headaches, lightheadedness, feeling like you're going to pass out, with joint aches and pains and fatigue, all of those fevers and sweats are common together with Lyme disease. And if you have them, they tend to come and go, sometimes increasing, sometimes decreasing. So my best advice to you with Lyme disease is, please, if you get a tick bite and you even get any of the symptoms I'm talking to you about, get it taken care of very, very early, because the most effective treatment for Lyme disease is in that very first month. If you get medications very early on, you have the highest probability of not dealing with chronic symptoms down the road.